Hi, my name is Amy Scalise, and I will be presenting on an important practice within the healthcare industry, interprofessional collaboration. Interprofessional collaboration is defined as providing comprehensive healthcare services from multiple healthcare workers from different professional backgrounds. The goal of these professionals is to work with patients and families, as well as communities, to provide the highest quality healthcare across multiple settings. In this type of model, healthcare professionals are engaged with each other and their patients and are motivated by improving outcomes that are holistic, reflective, integrative, and cohesive in nature. When healthcare professionals collaborate to provide unified, continuous, and reliable healthcare, the patient benefits and the organization also sees benefits. As reimbursement models continue to change, patient diagnoses become more complex, and intervention strategies become more intricate. Interprofessional collaboration has become increasingly important to quality healthcare. It is significant in that when teams of healthcare professionals work together effectively, healthcare outcomes are improved and patient experience is improved, and healthcare costs are decreased. There are several 21st century healthcare concerns that emphasize the need for interprofessional collaboration in the delivery of care. One such concern in healthcare delivery is the transition of care from hospital to home. Inconsistencies in this transition is when up to 1/3 of preventable and costly readmissions occur. The Transitional Care Model, or TCM, is an evidence-based approach that highlights the contributions of a nurse-led, team-based care to help with this transition. This team is led by an advanced practice registered nurse, such as a nurse educator, who follows a patient from hospital to home and coordinates with a healthcare team that includes physicians, nurses, social workers, discharge planners, pharmacists, and other providers to ensure continuity of care, prevention and avoidance of complications, and close clinical treatment and management. TCM also partnerships with patients and their caregivers who collaborate on the discharge plan and implement that plan in the patient's homes. Even if the coordinating advanced practice registered nurse is not a nurse educator, the nurse educator could still have a role in providing education on the program to members of the interprofessional team, allowing all team members to have an understanding of other members' roles. A public health emergency response is another 21st century healthcare concern that requires an interprofessional team to come together to quickly and efficiently save lives. Interprofessional healthcare disaster teams must be trained to work collaboratively to achieve optimal healthcare outcomes. In a disaster, no single healthcare professional can handle all the priorities. Therefore, leadership responsibility should be shared. This is best learned through a simulated experience with true roles and by practicing in an environment of mutual respect. As a nurse educator in an educational or hospital setting, I may be in charge of coordinating or debriefing disaster drills and emergency response simulations to train nursing students or practicing nurses. As a nurse educator, placing emphasis on interprofessional collaboration and how this team either did or did not work well together will be essential to make improvements in efficiency for a real public health emergency response. Another significant healthcare concern that emphasizes the need for interprofessional collaboration in the delivery of care is childhood obesity prevention. Childhood obesity has increased rapidly in recent years and is associated with many negative health consequences, including type 2 diabetes, asthma, and obstructive sleep apnea. In a school setting, interprofessional team may involve different members, but the concepts remain the same. According to the Registered Nurses Association of Ontario, nurses must collaborate with school leaders to assess elementary school environments for risk and protective conditions that influence childhood obesity, including student demographics, school policies, and food and physical activity environments. Collaborate with parents and primary caregivers, educators, and support staff to promote healthy eating and physical activity in a setting where preschool children gather. And in addition, healthcare professionals must participate in continuing education to enhance their ability to support the positive behavioral and environmental changes for children, families, and communities. As a nurse educator in a school setting, I may be responsible for planning educational programs for students or providing learning opportunities regarding childhood obesity for teachers and support staff. My Central Line Discharge Education Program is a nurse-led quality improvement project that will improve our discharge education on central lines for our families so that they are better able to care for their child's central line at home. This program includes several new tools to assist with proper assessment, implementation, and follow-up of discharge education. These tools include assessment of families' readiness to learn, a 7-word health literacy assessment that can be completed in minutes, use of teach-back methodology to ensure understanding of material, and a scripted follow-up phone call to ensure needs are met after discharge. The success of this program is dependent on several members of the interprofessional team, including bedside nurses, a discharge care coordinator, social work, physicians, or nurse practitioners. The bedside nurse will be responsible for implementing the components of the program, including readiness to learn and health literacy assessment. They will also be in charge of teaching, utilizing teach-back methodology. The social worker will also be consulted during the assessment of readiness to learn, especially if concerns related to housing or finances are brought forward. The psychiatric nurse liaison may also be contacted if there are concerns related to parent coping. The discharge care coordinator will communicate with outside agencies, setting up home care visits and follow-up appointments, as well as delivery of central line supplies. The physicians and nurse practitioners will be present in patient rounds and collaborate with nursing to determine when a safe discharge can be completed and communicate this information to patients and families. 3 themes related to the interprofessional team emerged in a study by Mueller, Judge, et al., and helped to categorize the perceptions that nurses had about their roles. The first relates to patient management. Nurses felt that their role on the interprofessional team was to ensure follow-up of their patients throughout their hospitalization, provide physiological support to the patients and families, and provide nursing care to their patients. In terms of clinical reasoning and decision-making ability, nurses felt that their role was to bring the decision-making into action through use of their clinical competence. As far as their role on the interprofessional team, they felt that they shared in the teamwork and open communication. For my Central Line Discharge Education Program, the nurse is the leader of the team as she is the one identifying any initial problems and then completing most of the education while providing support to patients and families. She will be the one to involve specific members of the interdisciplinary team when problems are identified or new concerns surface. The patient-centered outcomes of the Central Line Discharge Education Project include reduction or absence of sepsis, reduced morbidity and mortality, decreased CLABSIs in the home, improved family or caregiver confidence in caring for the central line, and reduced readmissions for CLABSIs. To achieve these outcomes, I will have to collaborate with the nurse manager and discharge care coordinator, as well as the unit CNS, to discuss the design and implementation of the program. Social work buy-in will be important, as well as referrals that will be sent to her, so she may be able to make suggestions on how to efficiently complete this task. The coordination of the program will require that the provider team, including residents and attendings, are aware and on board with the program, as well as discuss discharge dates and rounds, as this will be a new component of the program. It adds an additional detail into discussion during rounds. The evaluation of outcomes will certainly be an interprofessional effort, as outcome measures will come from many different sources. For the outcome measures, reduced or absence of sepsis, decreased CLABSI developed in the home, reduced readmissions for CLABSIs, collaboration with unit nursing leadership will be necessary. They will audit the emergency department electronic medical record and extrapolate information related to patients with central lines, documenting data on readmission documentation forms. For the outcome measure, reduced morbidity and mortality, I will need to collaborate with a pediatric quality and safety officer who will obtain data available through the Centers for Disease Control and Prevention. For the outcome measure, improved family or caregiver confidence with care for a central line, a collaboration with the discharge care coordinator will be necessary, as she will ask the caregivers questions regarding their confidence with central line during a follow-up phone call. Good communication is essential to working on a strong interdisciplinary team. Evidence has shown a link between interprofessional miscommunication and poor patient outcomes. In addition, ineffective communication can lead to patient dissatisfaction, misdiagnosis, delayed treatment, medication errors, and injury or death. Developing good communication strategies can help to aid in interprofessional collaboration. The first strategy involves communicating in a language that is universal to all healthcare professionals rather than to one specific discipline. Another involves understanding each other's roles through things like interprofessional workshops or clinical learning experiences. Breaking down barriers and building partnerships led to improved interprofessional communication. Finally, placing a patient's needs at the forefront of our collective decision-making allows us to mutually agree upon the best course of action. To summarize, interprofessional collaboration is patient and family-centered, comprehensive approach to improve healthcare outcomes and the patient experience while simultaneously decreasing healthcare costs. It is an effective discipline in any setting and can involve different members depending on the setting and the scenario. Practice makes perfect. Practicing good communication and collaboration is in a simulated setting or through interdisciplinary workshops allows for ease of role identification and improves teamwork in a real-life setting such as a code or disaster response. Keeping the patient's needs in mind as well as the patient's goal for treatment and recovery will allow healthcare professionals to remain on the same page despite a variety of differing opinions. For interprofessional collaboration to be effective, healthcare professionals must have a realistic expectation of the roles of other members of the group. It is essential that education about interprofessional collaboration be provided on prior to providing patient care and on an ongoing basis. As a nurse educator, I have the opportunity to provide education to nurses and other members of the interprofessional team that can directly affect how they deliver care and indirectly affect improved outcomes in patient care. And these are my references. Thank you.